This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to show you how to tell if your dog has hip dysplasia, a prolapsed disc, or degenerative myelopathy. Hello, welcome back to my channel. For those of you who are new, welcome. Thanks for being here. Today's video was inspired by one of you viewers, someone out there I've suggested in the past, please send me in comments. I love to hear what you want to know as far as suggestions around upcoming videos. So a viewer wrote in under the comment, said, Dr. Jones, can you please do a video and show us how to tell the difference between a dog having arthritis or hip dysplasia, a prolapsed disc, and this degenerative disease called degenerative myelopathy? And I thought, sure, that's a great idea. Hence, this is today's video. As an aside, you guys, before we start on today's video, it's about day 4 of my no coffee challenge. My kids had made a small bet with me, wagering that there's no way I could give up coffee for a week. Yes, it's $10, but it's been such a long time. It appears to be that coffee is my big habit. So now I'm enjoying some green tea, which I do like, and I've been trying to drink after lunch. But I just have such this huge coffee addiction. Hence, I'm having a bit of issues with it. I do find myself being more irritable. I think I'm feeling a little bit better. I'm not sort of up and down. But that being said, if I seem a bit cranky in the video, because I don't have my coffee. Lewis is a great example of how you should be doing a proper exam, especially differentiating between something degenerative such as arthritis versus something neurologic such as degenerative myelopathy or a prolapsed disc. Lewis himself, he's 13 and a half. He actually has a couple different things. Primarily he's got some from arthritis within his right hip joint. So he's fairly lame on that right rear, as well as he's got some arthritis in his front shoulder. He's been a good one for me to actually demonstrate to you how I would do an exam of a dog who came into veterinary practice and make that differentiation. Is it neurologic or is it arthritic? Because obviously that's going to affect our choice and our course of treatment. So the first big thing, anytime this were to happen in veterinary practice, a client's going to come in, such as your own dog, such as Lewis. You want to just watch him walk around. Walk back here, and walk forward. I'll let him walk one time back again, and I think you can probably see he does seem to, if you watch, he sort of favors, especially he's kind of pushing that right, he's sort of holding that one right leg sort of out to one side. And just visually watching him walk gives me a sense that, there's something going on with him, and it's likely that right rear. So the next thing with clients is I go through some form of detailed history. So you should be asking yourself, in terms of, watching your dog, how long has this gone on for? Did it happen all of a sudden? If it was, a sudden onset of something, then I'd more think of something like a disc that's been prolapsed. Like if your dog's suddenly lame, or perhaps he's pulled a ligament to cause the lameness in his rear. But if it's been sort of waxing and waning, going on for a period of time, then it's more likely something like hip dysplasia, arthritis, or this degenerative disease called degenerative myelopathy, where they slowly lose, the sensation and control over their rear limbs. Some of the other questions I would also ask is if the clients had noticed their dog sort of dragging his rear paws, or is he sort of sometimes folding under themselves, or have they noticed where their claws or their nails are starting to get really scuffed up, where something's been dragging. If that's happening, that's more a clue towards something neurologic, where the nerve is affected, be it from a prolapsed disc or degenerative myelopathy. The basis of the exam in terms of what I would do in practice and what you can also be doing with your own dog. To begin with, I prefer my guys to be sort of either standing up on the table or just sort of standing up first on the ground. Lewis isn't really liking it, so I'll let him relax first and lie down here. The first thing is just sort of palpating. We know that we're focused on the rear, so I'll show you here. I'll move Lewis here. I'm just sort of running my, my thumb, my index finger, just along Lewis's spine, just palpating on either side, and I'd put a little bit of pressure in between the vertebrae. just to see if he's uncomfortable anywhere. That gives much better sense if there's a disc that's affected or prolapsed in some way. So I'm going to run along, see if it's painful in any way. Lewis seems fairly comfortable. The other condition we can get is some of our older dogs can get this condition where parts of their spine will fuse lower down, called cauda equina. And they can actually get this entire ridge of bone. And that's generally lower down in the lower lumbar spine. But once again, often that would be uncomfortable or painful. And sometimes resemble something like a prolapsed disc where something is then pinching nerves as they exit the spinal cord. So I'd expect them to be sore as they're palpating his lower spine. Lewis isn't. You just want to put moderate pressure on your dog. All the way to the base of his tail, even along his tail. Sometimes I would just even give the tail a little bit of a pull to see if that was uncomfortable. So he's not there. Good boy, Lewis. You. The next thing I'd want to do is sort of flex and extend those limbs. And I'm going to show here, and we're going to just do it gently on Lewis. He's a bit uncomfortable when I fully flex and extend his hip joint. I would just, one hand holding and supporting the upper leg. I'm going to flex and extend this right hip. And if there's a degree of arthritis within the hip or hip arthritis or hip dysplasia, he won't let me fully extend the hip all the way, and Lewis won't, so I don't want to. You can see there where I start to extend it and he pulls it in. So that's telling me that he is sore within that hip joint. So letting me give me a clue like, okay, possibly there's some hip arthritis there. Then the next part of palpating that hip and that hip joint is I'm just going to put a bit of pressure here on either side. So this big bone that runs up here, it's called the femur. There's this point of the femur that sticks out, called right on here. There's big bony protuberance, sticks right on top of the edge of the femur. And there's two depressions on either side. So as you can imagine, the end of the femur is kind of like the ball of the hip joint, and that fits into the socket of the hip joint. But it actually goes quite deep within your dog. It's quite well protected by muscles, etc. But you should be able to palpate on either side of that. You can put a moderate amount of pressure, and that also happens to be the two acupressure points, GB29 and GB30. So a guy who's really uncomfortable, has a fair amount of arthritis or hip dysplasia, sometimes that can be fairly uncomfortable, and they're going to resist that too. So these are all just giving you a sense of helping you make that diagnosis. Sometimes in hip dysplasia you can actually hear a click, an audible click when you flex and extend those hips. And some people even notice that as they watch their dogs, and they'll actually say they hear a click. That's a potential big indicator that the hip is coming in and out of socket, and they have pretty serious hip dysplasia. In an older dog, generally we're trying to differentiate between arthritis and something neurologic. So there's all this inflammation, degeneration, they've lost the smooth covering over their articular cartilage, and it's just very uncomfortable and sore. So you're going to move it back and forth. And sometimes you can just feel around that joint or on top of that joint, you actually feel some crunching or crepitus. Likewise too, they can do something similar with the next joint down on his knee joint, which is right here. Just move it back and forth. You don't need to do a lot of force. Just feel if there's any sort of crunching at all. Now what I wanted to show you is a couple of neurologic tests, which I think are ones that you can comfortably do at home to get a sense on your dog having some type of neurologic deficit. So that could be the case definitely if you've got this degenerative myelopathy. And what that is that a condition where they're slowly losing the myelin sheath, this nerve covering over the spinal cord, is slowly degenerating. And as it degenerates, they're progressively losing sensation for their rear. So when that's the case, they're going to have these specific nerve deficits. Also, if you've got a pinched nerve, say from a prolapsed disc or cauda equina, likewise too, you can also have these secondary nerve deficits, and that's what you do in veterinary practice. So I think it's just really good things for you guys to know and have a better sense of, how you could potentially do this at home with your own dogs. So one of the big things is just testing the withdrawal. So I want to know is that if Lewis has sensation here, for instance in his toes, they're slightly pinched, I would expect him to pull his toes in. And I'm not pinching them hard, just enough that he gets a sensation that, yeah, I don't like that. And then see how he reacts? He pulls his toes in. When we have these dogs that would come in, they're sort of wobbling and ataxic, and we're suspecting a disc or something neurologic. And sometimes you could pinch their toes, they don't react at all. So that's a sense of, okay, there's something more serious going on that obviously needs to be further investigated. I'm going to show you one of the reflexes. Generally, when you do a full neurologic exam, there's a number of things you're doing. Sometimes the reflexes can be easily elicited, sometimes not. But the easiest one I found to get was the knee or the patellar reflex. And so what you're doing is you're actually just using a moderate to firm instrument. You're hitting straight on top of the patella. That's the knee, right on top of the knee tendon, the patellar tendon. And between there and the knee itself. So if you can bend and extend flex and extend your dog's knee, you can feel a sort of soft area right where my index finger is pointing on. So I've just got a little instrument here. And what you're doing is just hitting that with moderate force. And with this leg partly supported, Lewis should move that leg straight up in response to it. So in doing that, Lewis has a patellar reflex. So what that means is that we're actually testing the cranial nerves. We're making sure that these big major nerves that come from his brain, these reflexes, they're still sending impulses back and forth through his rear limbs. So what that means is that these cranial nerves are able to travel then down through the spinal cord, come down to this area, and send that, and that impulse then relays back to the brain, which tells this leg to move forward. So that's giving us a pretty good sense he doesn't have an impinged nerve somewhere along the spinal cord, meaning that likely his spinal cord is okay. The next test I want to show you is one I think is really good for you guys to know, and it's a measure or test of, it's called proprioception. So it's a sense of where anytime we place our foot down, our brain is involuntarily sending us impulses down to the area down to our foot, tell us to place it flat and square. You do it involuntarily. You don't think about it. You just walk normally. But there's a whole bunch of things happen every time you walk. You place your feet down. Similar with our dogs, our cats, our animals. They've got all these involuntary things happening. But when they have a condition such as degenerative myelopathy, where they're slowly losing this myelin sheath, and they're losing the ability for the nerves to contact down and send impulses down to their rear limbs, for instance, they're going to have a specific deficit. So this is a real big one. And often what would happen is the dogs, there's called a knuckling reflex, where they'll actually be delayed. What this means, you actually see their paws folding under them or knuckling. The test is I'm gently going to support his body weight with my left arm just underneath his belly. I'm going to bend his left foot over, drop it on the carpet, and the reflex means that as soon as it's bent up, he should then place it square, which he is. Just show it one more time. Oh, there. He's a little bit delayed, but he did place it square. So that means, once again, his nerves are sending those proper impulses. But in our dogs that would have something like a pinched nerve, prolapsed disc, degenerative myelopathy, that won't happen. So the big probably difference I see with degenerative myelopathy, which my last dog Jessie had, and I do have a YouTube video on it, and if you look up there, I'm going to have a link to that video up in the corner, is that generally it's non-painful, but it is progressive, and it's just really heartbreaking to slowly watch them just sort of waste and really have this sort of swaying rear hips, and that's what Jessie had. And he really, really did drag his rear paws where they folded right under themselves. Whereas in the difference with something like arthritis or hip dysplasia, it's progressive once again, but with it can also be painful. Likewise too with these dogs that have, a pinched nerve, for instance, it's very painful too. So with that being said, you find that you really want to make sure you're also giving your dog adequate pain control so they are much more comfortable. So I hope you guys have found that helpful, and as I just said earlier, please send in your suggestions and comments. I love to read them, and I also want to know exactly some of the upcoming videos I can make to help you. Thank you guys for watching this edition of Veterinary Secrets. If you've yet to do so, I encourage you to subscribe to my channel. You can do that by clicking that little circle in the box above. Then you can go ahead, click that link in the box below. I can send you my free books and videos on how to heal your pets at home with my top natural remedies.